So hi and welcome to podcast episode 3, which is Why Cancer Care. This podcast that opens the door to one of the most meaningful and dynamic areas in healthcare, whether you're a student, you're starting to think about your future, or someone just curious about how you can make a difference in people's lives. This series is for you. So I'm Melanie, I'm a project officer for Humber North Yorkshire Integrated Care Board. We have Alex Flowers.
Hi, I'm Alex Flowers and I work in the communications and marketing team for the local NHS.
We have Alex number 2, because we have 2 Alexes today, so hope that would be too confusing.
Hi, I'm Alex Campbell. I'm currently a chemotherapy sister for York and Scarborough hospitals. I've worked in the NHS since around 2006, so we'll be coming up to 20 years next year. I spent most of my career in cancer nursing, but the majority of it working on haematology and bone marrow transplant unit at Leeds. And then I came over to York about 10, 11 years ago and have worked on the inpatient unit at York, and then most recently transferred over to outpatient chemotherapy.
Okay, over to Maddie.
I'm Maddie. I'm a Band 3 healthcare assistant on the outpatient chemotherapy. I worked in AMU Award for 2 years, and before that I did health and social care at college.
Thank you, Maddie. Gemma?
Hi, my name's Gemma Anderson. I currently work as an acute oncology specialist nurse here at Scarborough Hospital. I've worked for the NHS for around 20 years. I had my previous roles, I've worked as a sister on acute medical unit, and also I've been a palliative care specialist nurse as well.
And Terry?
Hi, my name's Terry Cochrane. I work at Scarborough Hospital. I work in the outpatient chemotherapy department, and I have only been a nurse for 3 years, and I've worked on the unit for about 2.5 years.
Thank you, Terry, and thank you to you all for giving up your precious time today to join us on this podcast. So straight into it. So why choose a career in cancer care? So cancer affects millions of lives, and behind every diagnosis is a team of professionals working together to support, treat and empower patients and their families. From doctors and nurses to data analysts, psychologists, radiographers and researchers, cancer care is a field full of opportunity, innovation and heart. But it's not just about the medicine, it's about the people, compassion, communication and collaboration, and it's about you and the unique skills and interests that you bring. So in today's podcast, we will explore how to get onto your pathway today, how you will get there and what you would need to do, what personal skills that you may need to have, any certifications that are particularly valuable, and what advice would you give to someone considering entering into this field?
So I think we'll start with a little bit about your personal journey, your motivations, things like that. So I guess Maddie, with you being the most recent inductee into the NHS, what made you want to pursue a career in health and social care, and then why did you pick the department that you're in now?
It's not a very good answer, really, because after school I didn't know what I wanted to do, so I went to college and did health and social care, and I originally wanted to go into paramedic science, but I applied for uni, but I didn't get into the ones that I wanted to, and I got a job at the hospital and got put on AMU, and I worked there for 2 years. So I'd learned so many skills on AMU because it's such a generalised area, and then I picked up a shift here, and then there was a job going, so I got the job here, and then that's what really made me want to go into nursing, is after coming here, seeing a different whole perspective of nursing and how seeing people that are going home, and you see the journey of their treatment, which is really nice.
And is the hope, do you think, still to become a paramedic one day? There will be transferable skills there for sure.
No, I've fully gone into nursing now, so I'm hoping that eventually I'll get into either band 4 first and then do a top up to become a registered nurse, or just apply to uni and then do it that way.
That's great. And I guess, Gemma, will come to you. What inspired you to work for the NHS, and why the department that you're in now, and why York and Scarborough Trust?
Yeah, exactly. So I just remember it's probably around 20 years ago, and I was at sixth form thinking I'm not really sure what I want to do, and at first it was midwifery, and I applied and failed miserably because each of the feedbacks I received was you don't have any experience. So I actually found a little auxiliary job at the hospital and thought midwifery is not for me, and I really wanted to pursue a career in nursing. So I started from sort of the bottom and tried to work my way up, and I just feel like nursing is such an amazing career because you can work in sort of primary care, secondary care, and you can really go in different directions. It's really interesting. I worked on the acute medical unit for 8 years, and similar to Maddie, it's just like you just get so exposed to so many, interesting conditions. You meet a variety of people from different backgrounds, and I think that's what really interested me. And then slowly I started to feel like I wanted to specialise, and at that time palliative care really did interest me. With that field came cancer and oncology, haematology patients, which were sadly in their last year's days of life, which I found really challenging, and enjoyed, and did that career for 4 years. But then a role in acute oncology came up, and I thought that's a perfect role for me because it's a mix of acute medicine, but also I could bring my palliative skills there. And yeah, I've never looked back, and it's really nice to influence. I mean, I'm a Scarborough born and bred person, so to have the privilege of sort of influencing the acute pathways, it's a really special thing to think that, a lot of my friends or their families were fighting for the East Coast to make sure that they have the best service.
That's great. And I think that, do you feel like you were supported from your employer to pursue other opportunities within the NHS
Yeah,
and to
my
expand your career?
yeah, so each manager have always sort of pushed me, which is amazing. Like I was really comfortable in my last role, and I wasn't quite sure if I would be suitable for the role I'm in now, but my manager at the time was like, no, I think you should really go for that role. And it was really tricky to leave a role where you felt really comfortable in, but I'm really proud and pleased I did go for that role because I've met some lovely people. The chemotherapy team are amazing, and my current team are too. And there's a lot of teamwork, and in times of sadness, there's times of happiness, and I just think we're all a wonderful team who try and support one another.
That sounds great. It sounds like you've packed a lot into 20 years. Has it gone fast?
It really has. I mean, when you think you're not really going anywhere sometimes in your career, but then you look back and you think, wow, I have actually achieved a lot. And for me, my main thing is education. So I try and each year or every couple of years try and push myself to do an extra course, because I just think that then the patient has a better experience, because I've got extra skills to support them or get quicker, like assessments. So yeah, it definitely has gone very quickly.
Time flies when you're having fun, I guess.
Yeah.
And Terry, how has your career path evolved over time?
Well, I've had quite a varied career path, but I think for me, I guess I turned 40 and thought to myself, what do I actually really want to do in life? And I think nursing has always interested me. I never really thought I would be good enough, academically anyway. So I turned 40 and thought, right, okay, I'm going to do it. Got on the course and went to Bradford Uni to do it. But then sadly, just before, just as I was starting uni, my stepdad had leukemia. Well, he was diagnosed with leukemia, and previous to that, I worked as a ward clerk in my local hospital near Skipton, on the haematology oncology day unit, and I absolutely loved the patients. So with that, and my stepdad, who was going through the chemotherapy for leukemia, really had an insight into cancer care and to saw his journey, and really thought I could make a difference there, and really had an interest in cancer patients. I don't know, I just feel like I have a real connection with them. I don't know how or why. But then when I did my nurse training and qualified, I actually went into the community thinking that was what I was, probably was going to be my path. But then the job came up in chemotherapy in Scarborough, and I went for it thinking, again, I probably wouldn't get it being newly qualified. And I did end up getting it. It was amazing. And I'm so glad I did it, because I feel like I can make a difference to people's lives. I can make a difference, with the life skills I've gained over the 40 odd years. And I can empathise and sympathise with some of these people, especially like the haematology patient, because I've been through my stepdad's journey. So I really do feel like we get the time, we can spend the time with our patients to make a difference to their cancer journey. And I feel that's quite a privilege working in Scarborough, because the team's so small, and we do really get to know our patients really well. And yeah, there's never a day where I don't enjoy coming to work. I look forward to it, and I always try and give the best sort of experience stroke service for the customer on that day, because they're obviously going through a terrible time, and I feel quite privileged to be able to do that as a nurse.
Oh, thank you, Terry. That's really nice of you to share your personal story as well. So you've all had different sort of entry paths in, I guess, and quite varied, starting off thinking you wanted to be something, and then it's took you down a path where you've ended up being something completely different. So yeah, I think both Alex and myself have maybe got similar things, and that's the thing with working in health and social care, isn't it? There's so many paths that you can go down, and if that something isn't working out, then there's always something else to have a look at and go down.
Yeah, and I think actually wanting to come to work and enjoying your role is something that everybody wants. And Alex, I guess you've said you've worked here for nearly 20 years now. So is there any reasons why you've stayed around for so long, or is it just love of the job?
I think my avenue into cancer nursing was a little bit accidental, actually, because I thought I was applying for a job on a medical haematology ward, and then I realised halfway through my interview that it was actually a bone marrow transplant unit that I was interviewing for a job on. So it wasn't really my intention to ever work in cancer nursing. So 16 years ago, I applied for a job, and I've stayed in cancer care since then. But I didn't. I think a lot of people, nurses that I trained with and things were sort of saying, oh, I'm going to work in cancer medicine. And I think there is a sort of cohort that I've met along the way who do, passionately think that avenue is for them. But I think there's as many people, who come into it in a more accidental way, like me. And then you realise the benefits of working with cancer patients and in cancer nursing. And I've never gone back to general medicine. And haematology really carved out my career, and I've worked on wards for the majority of my career, and I love ward nursing. And then I've kind of moved over into the outpatient arena in the last couple of years, which has brought new challenges and a new direction to my job and my role. And it's just, there's always stuff to learn, and that's the great thing about nursing. You can find a different avenue to suit your skills or your time in your life and things. When I was on the ward, I did a lot of nights for a lot of years, and my kids were little, and that suited in then, and you just adapt and change as time goes on. So it's just such a dynamic career, nursing, and within cancer nursing, there's so much you can do.
Yeah, I mean, you've stayed around for a long time, so it clearly shows that it is a career that can be very rewarding, and something that can just be a nice place to work in. I guess in terms of like your day-to-day work, Gemma, I guess what would a typical day in the life look for you? Obviously, it might not be the same every day, but like for someone who's thinking about doing what you do, what would a typical day in the life look like?
So acute oncology, it's sort of quite a new career. It's been around for the last sort of 10 years. So our role is to basically deal with any chemotherapy, immunotherapy or radiotherapy side effects, or any cancer emergencies. So we provide a triage line. It's a 24-hour service. So we filter the calls coming through and grade their toxicities. And then we decide on the place of assessment, whether that be in our clinic, which we run, or it could be sending them to their GP, or we could send them to A&E. Another part of the role is reviewing the patients who are hospital admissions, and we try and get a speedy and timely assessment, and then put a management plan in place. And this hopefully, one, it's great for the patients because they're getting advice in a timely manner, and two, if they are septic from their treatments, hopefully they're being reviewed in the first hour, and the quicker the review, the better the outcome. And then also we support the chemotherapy team. So if a patient turns up unwell, then we'll pop down to the unit and assess them and try and get the patient better. So it's quite a varied role. So we look after inpatients, outpatients, and run a triage line. We never know, every day is different. So the diary could look quiet, but then you've inundated with triage calls, or the line might be quiet and you're busy with the inpatients. So it's quite a varied and challenging role, but it's really rewarding because the patient gets a timely management plan. If they were just going to their GP, they'd be waiting 2 or 3 days to be reviewed, whereas we've got the luxury of being able to see them, in a short time frame.
And Maddie, I suppose with you being relatively new to the organisation, is it what you expected? Is the day-to-day work what you thought it would be?
No, it's not what I expected. I didn't think that I'd have much interaction with the patients on here as I did the other way around. I didn't think I'd have as much interaction with the patients, because on AMU you don't see them very often. They're in for a day or two and then they go. And then here you can build a relationship with them and get to know them. And when they start to remember your name, it's really nice, and you really know stories about them, and they're asking about how you are. So that is drastically different. But when I first came into the hospital, I had no idea what I was expecting. I was 18 when I started, and yeah, it was very interesting, to say the least. I just got thrown into everything, but I'm grateful that I did, because I learned so much from that. But
sometimes that's the best way, isn't it, to be thrown in and see what happens. I think that happens to a lot of people, to be honest.
Didn't have a choice, really, just got on with it. But I worked in a shop before, so that was very different.
So, Alex, I guess you said that you obviously with working here for such a long time. How's your day-to-day work changed over time, and what does it look like now?
I suppose now I'm maybe a little bit less clinical than I was, but I still do a fair amount of clinical work, which is a really good mix in my job, because I wouldn't like not to be treating patients and knowing patients. But I manage a team of around 40 people cross site. So there's lots of looking after staff and, looking after a variety of sites, because we've obviously got our base at York, our base at Scarborough, and then we've got the mobile chemotherapy unit that visits Bridlington on a Wednesday, Moulton on a Thursday, and Selby on a Friday. So there's a lot of coordination, lots of patients to get booked in for chemo, work out ways of fitting them in. Obviously, our patient numbers are increasing. We've got more and more treatments coming through. Patients are living, longer on treatment, which is great. So it's just about finding ways to fit everybody in. And so my job is a lot of different things depending on the day.
And Gemma, I know we spoke before, you spoke about MDT meetings, so that's quite a collaborative meeting that comes together, and that's, you just want to explain a bit more, maybe tell us what MDT stands for also.
Yeah, sure. So I'll just focus on, say, lung cancer. So for a lung cancer MDT, which is multidisciplinary team meeting, basically you have all the health professionals in room. So at the beginning of somebody's cancer journey, there's a suspected cancer found. So they may have, I don't know, a CT scan, a biopsy. Then you would have the radiologist in the room. You'd have the histologists, so discussing what the tissue are growing on there. Then you would have the respiratory doctor talking about all the investigations they've done, and then the lung cancer specialist nurse in the room, and then the oncologist, and that group of specialties will then discuss the next steps for the patient, whether that be further investigation, or that patient suitable for surgery, or actually we're going to go down the oncology route, so offering chemotherapy or immunotherapy. So in just that one room, there's so many specialities and linked to cancer. So
and that goes back to the personal sort of skills we sort of mentioned earlier on as well, isn't it? What sort of, you know, personality skills do you maybe need to make a good nurse?
Yeah, and I think like when you're in oncology, you've got so many skills. Like, although you're assessing them, you're picking up on their cues. Are they feeling sad? You're looking at the body language. Even though they're saying I'm okay, their face could be, and their body language could be completely different. And I think we've all got those really good skills to tune in, even when they're walking down the corridor, that they don't realise that we're assessing them as they're coming down. So I do think, like, being in this field, I've definitely learned a lot of, you know, like assessment skills, communication skills.
So Maddie, we've got a question for you next. What's the toughest challenge you've faced so far, and how have you overcome it? I know that's quite a on the spot, maybe difficult question, but if there's anything that you can think of that you thought, oh my goodness, how am I going to do this? But you did it.
I think when I first started in the chemotherapy department, I was really overthinking about how do I speak to people going through cancer treatment? How do I make them feel seen and not patronised or belittled at all? So I did a lot of thinking about how to go about talking to them. But it's just normal. You just speak to everyone normally, have a laugh, joke with them if they're up for it. If they're not, you're just sensitive about the situation. I think that was the biggest part. When I moved from the ward, I did a lot about how to speak appropriately.
So it's a communication sort of barrier that you had, maybe to think, you know, how am I going to communicate? But it's, you know, it's just like you say, everyone's the same, aren't they? Other people have different things going on in their lives. So okay, so emotional fatigue and burnout. We're sort of interested in how you manage that. And again, I think, Gemma, we've spoken about, you do have certain things.
So we have clinical supervision, but I actually recently just applied charitable funds for my team to do meditation, because a few weeks ago we were just feeling a bit burnt out, and people weren't switching off from work, so we just started going every Monday, and I think people have found it useful, and it's quite handy on a Monday, because sometimes Mondays can be quite busy, and then it just sort of throws your week off, so it's quite nice to reset and then go back into the week again.
And that's surprised. That's something I kind of didn't know, that you know, would have a psychologist every sort of 6 weeks. So, you know, I think that's amazing that happens. And I had no idea.
I guess, Alex, you said you managed like quite a large team. What things are in place to help staff with their well-being? Obviously, it is quite a stressful job. What does the trust, what do you as a manager do to help people with their well-being?
So again, we can tap into psychology. They've come and done sessions with us before. But I mean, as a manager, I have a very open door policy for my staff. So if they're having a bad day, you know, I'm always there to listen, and I have a really good team of deputy sisters as well, who are really supportive to our more junior staff. The trust as a whole, you know, has other well-being and staff benefits and things that people can access. But within the department as well, you know, recently we did an escape room evening out, and then we had burgers afterwards, and we managed to get some charitable funds for that, which was a great team building exercise. And we organised quite a lot of social events within the department. Everyone seems to like a bottomless brunch now, so we do that in York on a Saturday sometimes. So, you know, there's lots of friendships within the department as well, and, you know, colleagues and friendships. You know, it's a good social environment to work in as well. The Christmas do's are good. And
chocolates at Christmas, I think you get a lot
yeah,
of those, don't
I mean,
you?
our patients in return, are ever grateful. We get lots of chocolates and biscuits, and there's never a day that you go into the staff room and there's not something to eat. So yeah, we're well fed. It's not a good place to be if you're on a diet.
Okay. So the next thing was just to sort of dispel misconceptions about cancer care careers. I think, in general, sort of you hear cancer and it's quite a scary word. Then you sort of think about maybe cancers in careers, and it can, come across a certain way to maybe a lot of people. Also, what's good about it, what the positives are about it. It's not all. You do get patients that do, obviously get better and leave and go on and have a completely normal life. I think we spoke about arranging a wedding, and like I just mentioned earlier, the never-ending boxes of chocolates. So yes, if we could just maybe talk about the positivity and dispel the misconceptions.
I think, Terry, you mentioned that it is a nice place to work earlier, and that that the environment is quite upbeat and positive. Would that be a fair reflection on the place that you work?
Everybody just hears the word cancer and has a really has a preconception of there's just one chemotherapy, they're going to be really poorly, but there's so many different treatments, there's so many different cancers. And I think when people come for pre-assessment, I think us in the department, I feel we really do, we really are able to put their mind at ease. And yes, they are still apprehensive about having the treatment, but I feel our pre-assessment days on a Monday, are always quite remarkable, because the patient might come in really nervous and you can see that they're just so frightened, but when they leave, their body language is different, their shoulders are down, they feel like we've really explained to them what's going to happen. Like, a lot of the time throughout their journey before they get to us, it's there's the appointments, there's the scans, there's the consent, and then they get to us, and I think we're really able to to turn it around for them sometimes, not every time, but most times. We get to make their experience a lot easier, and they're not as worried about having chemo as they once were maybe before they came. So I do feel like we're really privileged in our role to be able to give them that experience, and we have a really good team where we are. We're really quite a small team, so you can build up those relationships, and I really do feel like people don't expect the treatment they get when they arrive, and I think they have, like I say, a preconception of chemo, and they're going to be there for hours, and some people's treatments are really quite short, or might just be an injection. So I feel like we can really put people at ease, and like Maddie would say, have a laugh with people sometimes, and I don't think people would expect that. Well, I think when you're told you have cancer, I feel like people have different ideas, but I think we're able to turn that around for them and give them a really good experience. We've got some fabulous members of the staff who are really clued up on cancer and very knowledgeable and very skillful, and I think that really shows in the way we care for our patients, because the chocolates we get, the cards, the thank yous, the appreciation that people show from our unit, I think is amazing. And I don't think people would expect what we get, and wouldn't expect to be treated the way they are. And I think that's a real privilege to be able to do that, and to change people's minds about chemotherapy, and it's not as bad as maybe they would have thought. I think that's
No, that's great. And I think it's obviously, like you say, you work with, there's a lot of patients, and also you have a lot of conversations with these patients. So Alex, I wonder if ever patients' feedback or anything that they say was ever changed the approach of the way that you work.
I think there's always, you've got to admit as a nurse what your strengths and your weaknesses are, and I've got different nurses for different people in some ways. So like I was saying about my journey into cancer, it's a bit accidental. I can be quite straightforward with people, and some patients like my approach, but I've got other nurses who are much more touchy-feely and huggy, And some patients really like that approach, and they get a mixture of all different personalities, because every time they come in, they probably get different people treating them. And you find who fits with different people. When they're going through a different time, you know who the best person is. So it's all about, I think, utilising the right people in the right place, and we give really good personalised care within the chemotherapy units. You know, the patients are really lucky to have that, and the staff are really lucky that we're able to do that. And we're really proud of the personalised approach that we have.
No, that's amazing. And I think that would give the patient a massive bit of peace of mind as well, to know that, to get to know the person that's treating them, and to know that the personalities sort of match. I wonder, Gem, if you have any memorable sort of patient stories that have had a lasting impact on you.
Oh, that's a good one. I suppose I'm just trying to think. Yeah, I think the curative ones are always interesting. So they arrive in the department really well, and then we give them chemo, and of course it changes them physically, and they're actually really frightened after the first dose, that they felt so unwell. And it's really nice to be able to give them that support and advice, and ask them to trust me. If you just take these medications, you're going to feel much better, and just be mindful this might happen on the second dose. And that frightened person, when they come to ring the bell at the end of their treatment, they're walking out a different person. And actually, I always feel like they're really sad to leave the department when we wish them well, because they've had such good, amazing care and support, and they didn't expect, like Terry said, to make friendships. And it is like, it is sad for the team as well. We're so happy that they've ring the end of treatment bell, but at the same time you're like, oh, I'm going to miss that person. You know, not visiting every week. And often they'll come. Sometimes maybe their husband might be on a chemotherapy treatment plan, but they'll come to the door to wave and have a chat with us. So I think that speaks volumes too, that you know, we are a very friendly bunch.
I think it's I always think of it like a chapter in people's lives, and sometimes the chapter is in the middle, and they come in and have that chapter, and then they go on and move on with their life. Sometimes the chapter's at the end, but again, we are only a chapter. And actually, I have gone to patients' funerals, and you realise what a tiny chapter we are in that whole person's life and journey. And it can be quite humbling, really, actually, that we are just a little chapter, and we never really want to be a chapter, you know. So yeah, that's how I kind of think.
And sometimes you've only met them maybe once, but they really remembered you, and you made them feel how they made you feel, which is really amazing.
I guess, you know, you're just looking for some reassurance, aren't you, when you're in that position? And obviously you've just been given news and you're not really sure how to feel or how to act, or you just want, you know, that guidance. And it sounds as though you know, you are the perfect guys to give that guidance. Yeah, safe hands.
And Alex, how do you sort of celebrate successes within your team, so the successes of staff?
So
Star of the month.
We
the board?
Yeah, we have Star of the Month on the board. So we normally pick someone who's had really good patient feedback, or gone above and beyond, or achieved something in education, to be our Star of the Month. The Trust obviously has a star sort of celebration of achievement and star award thing as well. We've had lots of nominations through those over the years. So lots of people wander around with star pin badges on their uniforms. Maddie's demonstrating one next to me. And, you know, we celebrate achievement every day in our staff briefings in the morning. You know, we're always ready to sort of congratulate and, you know, celebrate the little achievements along the way. Yeah.
No, I agree. It's not even just a professional things as well in the staff meeting. Like if someone's having a baby, that will get celebrated. It's very personal, and the relationship we all have with each other is we're just friends really. We all get on really well and work really well together.
Weddings, babies,
Yes.
engagements, birthdays, everything really gets celebrated.
Great. Okay, so sort of looking into the future now then, what sort of changes do you think you can foresee in cancer care, maybe over the next decade or so?
I mean, I think huge changes. We've got, you know, more and more new treatments and different treatments. You know, traditionally everybody thinks of chemotherapy, but we're not even really supposed to call ourselves chemotherapy anymore. We call ourselves systemic anti-cancer treatments, which covers a whole, you know, variety of immunotherapies and things. I mean, the future is amazing in cancer. You know, AI and everything that's coming through is going to hopefully improve our patients' outcomes and our working lives along the way. So I think, you know, the focus really moving on has got to be on education and funding for new treatments, and yeah, it's a really exciting time to be in cancer, because I think the future looks so promising as to how we can, you know, we've got patients now who are going on to treatments and we really can't say how long that treatment is going to work for, because we just don't know. And that's amazing to be, you know, 10 years ago we'd have been saying to those patients they might have less than a year to live, and now we're saying we don't know how long you're going to live, but it might be 10 years plus on some of the therapies we're using. It's absolutely amazing.
Amazing. So how do you keep up to date with all the new treatments and technologies and things that come in?
I listen to lots of podcasts, which I think is a really accessible and easy way to stay up to date. We have networks of nurses where we, you know, especially now, I think with technology, you know, it's much easier to have a Teams meeting with people from all around the country. So in the past, we were maybe limited to people who we could work with and share knowledge and things with regionally. And it took a lot longer to get things, you know, find out what people were doing further around the country. Whereas now with Teams and things, we're able to access, you know, different hospitals and different practices. We have the UK Oncology Society that we utilise for, you know, Gemma's team uses it as well. That puts us in touch with colleagues all around the country that we can, you know, share practice and improve our practice from learning from.
Brilliant. Great. Okay, I think sort of coming to the end of our podcast now, just to wrap things up. So just to say that you don't have to be a doctor to work in cancer care. In fact, some of the most vital roles are in nursing, AHP, pharmacy, diagnostics, IT admin and patient support. There are also roles in public health, policy and education, all contributing to better outcomes for our patients. And here's the exciting part. Cancer care is constantly evolving. Advancing in technology, personalised medicine and data science are transforming how we detect, treat and understand cancer. This means that new roles are emerging all the time and fresh ideas are needed. So on behalf of myself and Alex, we would just like to thank you all very much for joining us today. Yeah, it's been quite emotional, hasn't it? It's you know, I just feel all warm and fuzzy inside. It's you do a great job, and I think, you know, myself and Alex have learned lots, and hopefully when we get the podcast out, the people who are interested in this career will. So yeah, just a big thank you for you spending your time today with us this morning, and yeah, have a nice day.